Hello, everyone. Good morning and good evening. Thank you all for joining today's session, which is on the Health Cloud Basic, the data models. My name is Vanan Rastogi, and I'm the subject matter expert in Health Cloud at Realtis Technologies. One second, please go to the next screen. Thank you. So, a brief overview of our organization here. We are a Salesforce partner organization that helps in designing and implementing custom business solutions in the most effective manner. Apart from the Salesforce, we are also partnered with multiple big organizations like AWS and SAP and many more. And apart from just assisting in implementing the custom business solutions, we have our own in-house product that is the Realforce. It helps in automating the release management process. And apart from just these two technologies, we are also working closely with the semiconductor industries and the manufacturing industry. So let's just quickly dive into our today's session agenda. That is, what is a Salesforce Health Cloud and the different data models. So I'll speak a little bit about the Salesforce Health Cloud here. So Salesforce Health Cloud is a cloud-based platform that helps the healthcare organizations to deliver a better patient care. It provides a unified view of patient data, which includes the medical records, the social determinants of the health, and the patient engagement with the data. So Health Cloud also includes tools for care coordination, patient management, and health management. It is so flexible platform that it can be customized to meet the specific needs of any organization. Therefore, it is widely used by a variety of healthcare organizations, which includes your hospitals, clinics, physician practices, and payers. So overall, Salesforce Health Cloud is a powerful tool that can help healthcare organizations to deliver a better patient care, improve their efficiency, reduce their costs, and improve the patient satisfaction. We have implemented both standard and custom solutions in healthcare domain. Today we have Pranjit Thoran as a senior analyst who will explain further in depth about the different data models that we have in Health Cloud. And if you have any questions, please feel free to put them in chat and we will take a few questions at the end of our session if the time permits. Over to you, Pranjali.
Thank you so much, man. Hello, everyone. Good morning and good evening to all of you. So, thank you for the joining today's webinar. So, I'm Pranjali, the Salesforce QA in Realities. Okay, so the today's agenda is what is Health Cloud, then the Health Cloud data models, and types of various data models. Okay, so first is what is actually Health Cloud. So, the Salesforce Health Cloud is like a smart computer system so that helps doctor, nurse, and other healthcare workers take better care of patient. So you can see in the pictures. So the uh, physician, nurse, then caregiver, etc. There are the stakeholders in the health cloud. So it keeps all of the patient medical information in one place so that doctor can see everything that need to know about the patient's health through a complete CRM. Then it also helps different doctors and nurses work together as a team and remind patients about the appointments and medicines. So Health Cloud provides some open ecosystems like the territory management, then the uh, clinical income, so etc. So that's it about the Health Cloud. Moving forward, so now the data models in Health Cloud. So the Salesforce Health Cloud encompasses various data models that cater to specific aspects of healthcare operations. So each data models play a crucial role in organizing and managing data within the platform. So let's explore the key Salesforce Health Cloud data model. So the first is household, then the clinical, insurance and claim, care program, and the provider data model. So today we are covered the five data models in the Health Cloud. So let's see one by one. So now the first is household data model. So in the household data model, map the relationship between patient or member and the people and organization who participate in their care. So this map help caregiver work more effectively as they engage with the patient and provide them with the appropriate care. So the household is related to a contact part of the individual using the account contact relationship junction object. So the account can be related to a different contact using a contact to contact relationship junction object. So to understand it better, let me give you an example of this data model. So here the charge person account record number one has a account contact relationship number two with a green household account record. Okay, so because Charles is a patient and he has a primary contact for the household, and Sean person account record has also a account contact relationship with green household account record. So Sean is a secondary contact for the household account record, and the Charles has a contact relationship with Sean because Sean is a Charles' wife. Okay, so that's it in the household data model. So moving forward with next data model. So the next is clinical data model. The clinical data model capture a patient clinical data. So an electronic health record is a digital version of the patient paper chart. EHR are real-time patient central record that make information available instantly and securely to authorized user. So clinical data can be integrated with Salesforce using standard APIs. So again, we will try to understand with an example. So here, the Charles Gain is a person account. Charles has a healthcare related interaction with the healthcare provider. A clinical encounter record refer a patient person account record. So, child visit a Posic Center hospital. So, clinical encounter facility specify a healthcare facility where an encounter occur. A clinical encounter facility record refers a parent clinical encounter that the health cloud facility record of a center hospital. In charge meet with Dr. Peterson. The clinical encounter provider specify a provider involved in an encounter and the detail of their involvement. A clinical encounter provider record refer a parent clinical encounter and the healthcare provider record for Dr. Peterson. Then the child has a pain in his lower back. So clinical encounter reason specify a reason why the encounter happened. A clinical encounter reason record refer the parent clinical encounter record and a care observation record. Then the diagnosis indicate that the child is suffering from muscles and ligament strain. So the clinical encounter diagnosis specify a diagnosis related to a clinical encounter. A clinical encounter diagnosis record refer the parent clinical encounter record and the condition or procedure relevant to an encounter. Then the Dr. Peterson request test to confirm that the extend the charge injury. Then the clinical encounter SVC request specify a request for a healthcare procedure or diagnostic service. A clinical service request record refer a parent clinical encounter records and clinical service request record. So this is all about the clinical data model. So now moving forward with next data model. Now the third data model is insurance and claim data model. So it capture everything around insurance, basically your plan benefits, member plan and purchase. So the provider has to make a claim, and the claim means something is billed and they have to get a reimbursed. So they create a claim. To create all these claim in this claim data model. So here also we'll jump to the example of this data model. So here also the charge green is a member who is covered under an insurance plan. A account object with a person record type represent a member. A member has a relationship with a purchasing organization. For example, the member is an employee and the organization is their employer. So the charge enroll in Bloomington Health Plan prefer provider plan. So the member plan represent a detail about the insurance coverage for a member. A member plan record refer a purchase plan record and the payer organization here. So as part of this policy, CHAS is entitled of rehabilitative service. So coverage benefit represent a coverage benefit that member plan provide to cover a member. So each coverage benefit has a benefit item. So this benefit includes up to, for example, 30 physical therapy visits per year. So the coverage benefit represent a specific service that member plan covered. So this is all about the insurance and claim data model. Then we will move forward the next data model. Like our then the data model is care program data model. So the care program covers services such as the patient outreach, access to care and meditation, financial assistance, and the fitness and wellness plans. So a care program data model helps you to capture those activities. So you can use Health Cloud to plan and track them better. In healthcare and the life science organization provide a care program to support a patient on their health journey. So now we will see an example of this data model. So here also the charge in is a patient. So account object with a person record type represent a patient. Then the charge green enroll in good health pain management care program. So the care program enrollee represent a participant enroll in a care program. Charge is eligible for good health pain management care program because he use pain away medication. So care program eligibility rule represent a rule that define the criteria for patient care program enrollment eligibility. So for example, enrollees must use pain away medication to be eligible for the good health pain management care program. Then the enrollment eligibility criteria represent criteria that define patient enrollment eligibility for one or more care program. For example, enrollee must use pain away medication to be eligible for a one or more care program. Then the Health Cloud pain management care program has some goal. So the care program goal represent a business or clinical goals related to care program. It's include data such as a detailed descriptions of a goal. And it's also priority or sequence order related to the other goals. Then the ME is a ME is a care coordinator for the good health pain management care program. So the care program team member represent a person who delivers services under a program, such as a program member or care coordinator. A care program team member record reference the care program record and a person account or a user record. So this is all about the care program data model. Then we'll move forward with next data model. So the next is provider data model. So the first, what is the provider? A healthcare provider is a person or company that provides a healthcare services. So the a provider data model represent a healthcare providers include individual practitioner and a facility, the network they participate in and their specialty and the credentials. So now we will be see an example of this data model. So here the business account record represent a PT health specialist downtown branch. The business account record reference a healthcare provider record for PT health specialist downtown here. Then a healthcare facility record here for PT health specialist downtown. And the business account record for a parent business account. So this is all about the provider data model. So today we have covered the 5 data models with example. So yeah, so that's it about the data models. Yeah, thank you so much, everyone.
Thank you, Pranjali, for such a detailed description of all the data models. Thank you for walking us through this. And now we can quickly take up some questions as we are already close to the time. So let me see. We have few questions here, Pranjali, without them. Yeah. So we have one question here that is, how can a healthcare organization can use a Salesforce Health Cloud to improve their patient care?
Okay. So the in Health Cloud improve patient care in a number of ways. So including the comprehensive patient view, then the simplifies the patient engagement. Then this Health Cloud offer a various tools for patient engagement and self management. So the patient can access their own health records, then the schedule appointments, receive reminder, and communicate. Communicate their own health record. So the schedule and also the their healthcare providers through a portal and the mobile application also, and also the care coordination and collaboration. It allow different providers include doctor, nurses, specialists, and caregivers to access and update the patient information in real time. So yeah, that's it.
Okay, thank you. Moving forward, we have one more question here. That is, what are the some challenges in implementing the Salesforce Health Cloud? So I'd like to take this question up here. So there are few challenges that we personally face in implementing this health cloud solution. So the first is the complexity. Though the Salesforce provides us a very good health cloud standard package here, but as we move forward, and it also provides us an ability to modify it as per our needs. If we have any custom solutions, we can go ahead and implement it correctly there. So we have to manage things properly because here we are handling the whole patient data that's related to the medical record. So we have to plan out everything in advance firstly. So this is how the whole flow will flow. And then again, there are many things that we have to keep in check because it's related to the healthcare. And the another thing I would say here is a little bit of the cost. So Salesforce, but it can be a very significant investment because there are multiple benefits of the Health Cloud here because they provide you multiple things in which you can ease the patient management in a system. So these are the few challenges I would say one can face while implementing the Salesforce Health Cloud. Moving forward, we have one more question here that what are the key features of the Salesforce Health Cloud?
In Health Cloud includes a various features, specially designed for the healthcare industry. So, for example, the patient relationship management, then the care coordination, the patient engagement, then the integration to EHR, means electronic health records, then the 360 view of the patient data, a personalization experience for patient or healthcare provider, then the clinical data management, many more.
Okay. So we have one more question here. I think this is the most asked here. That is how the clinical data model is different from the household data model.
Okay. So in the household data model, we include a person. So person who can help you to achieve your daily goal, or remind you to uh, take a medicine on time. So this person can or cannot be in medical assist. So where vice versa, in the clinical data model, we have a care coordinator who provide your medical assistance. So which may include changing medical for a better reflect. So logging in your pain logs, then creating a goal to minimize the pain and the better recovery. So these are the big difference in clinical and the household data.
Okay. I think we are close to the time as well. So I would like to thank everyone for your patience and the wonderful questions. If you have any further questions, please write to us at sales@realtis.com. We would love to resolve your problems in healthcare domain and can be your implementation partner in Salesforce Health Cloud. Thank you.